Good afternoon, everyone, and a very warm welcome to all of you. I, Calvin Allen D'Souza, student counselor of MAHE, I am the master of ceremony for today's talk on balancing mental health during COVID pandemic and repercussions of substance abuse by renowned speaker Dr. Rayan Mathias, student counselor MAHE. This talk is a part of the project Nasha Mukt Udupi Abhiyan by involving the young leaders of MAHE, organized by the Department of Student Affairs, MAHE, and funded by the Ministry of Social Justice and Empowerment, Government of India. Now I request Dr. Geeta Maya, Director, Student Affairs, MAHE, Principal Investigator of the Nasha Muktu Udupi Abhiyan by involving young leaders of MAHE project and Professor in Department of Computer Science and Engineering, Manipal Institute of Technology, to formally welcome everyone and also introduce our renowned speaker of the day.
Good afternoon, ladies and gentlemen. It gives me immense pleasure to welcome you all to today's talk on balancing mental health during COVID pandemic and repercussions of substance abuse by acclaimed speaker Dr. Rayan Mathias, student counselor MAHE. This talk is a part of the project Nasha Mukt Udupi Abhiyan by involving young leaders of MAHE, organized by the Department of Student Affairs MAHE and funded by the Ministry of Social Justice and Empowerment, Government of India. Dr. Rayan, at the outset, I welcome you very warmly and thank you for accepting our invitation to deliver this talk. I extend a very warm welcome to all the participants of this talk. I hope it will be an enlightening and fruitful session for you. I also extend a cordial welcome to all MAHE officials, faculty members, student friends, and all other distinguished invitees attending this talk. Dear friends, we are all aware that the COVID pandemic, which has been going on for more than a year now, has caused a lot of physical and mental hardships among the people. Most of us have found it extremely difficult to deal with mental stress due to our own suffering or the affliction of our loved ones. Another important and related topic is the repercussions of substance abuse, which is an evil in our society. Drug addiction can lead to serious long-term consequences like disorientation in physical and mental health, career, and relationships. It's of utmost importance that we make our youth realize how consumption of drugs greatly reduces the quality of life, especially the state of one's mental health. Today's talk will provide a lot of insights on balancing mental health during COVID pandemic and repercussions of substance abuse. It's my great pleasure to welcome and introduce our eminent speaker, Dr. Rayan Mathias, student counselor at MAHE, who will share his expertise and experience with us today. Dr. Rayan has a bachelor degree in social work and 2 master degrees, that is MSc in Applied Psychology and Master of Social Work. He obtained his PhD from the Bharat University, Coimbatore in 2019. It is noteworthy that Dr. Rayan was the university first rank holder in both BSW and MSW and was awarded the gold medal for his outstanding academic performance. He was also the best outgoing student in both BSW and MSW. Dr. Rayan worked as assistant professor and coordinator at the postgraduate department of social work, Milagres College, Kalyanpur from 2009 to 2018. In July 2019, he joined MAHE as student counselor and has rendered outstanding service as a warm, caring, dedicated, and highly effective counselor. I'm happy to state that he has been a great asset to the Department of Student Affairs MAHE. Dr. Rayan has attended several national and international seminars and conferences and has presented and published several research papers. He holds memberships of several prestigious professional associations. He has also attended around 20 training seminars and workshops, and he himself has been facilitator, resource person, coordinator, and chief guest for more than 60 programs and events. With this brief introduction, I present to you Dr. Rayan Mathias and request him to deliver his talk. Over to you, Dr. Rayan.
Yeah. Thank you, madam. Thank you very much. That was a really lovely presentation and discussion about me. I'm really grateful to you. So let me start my discussion with you and let me share my PPT first. So dear friends, we are going to discuss today. I feel it is a more than a talk. I feel it is a discussion where balancing mental health during pandemic and repercussion of substance abuse. What we need to really know here is that in this pandemic period, we need to know that how to balance our mental health. At the same time, how mental health and substance abuse are related, or what happens if we have both the issue, like one, if we have mental health issues and if we have substance issues together, how that become more problematic, or how that create a worst condition for an individual. So dear friends, you might be knowing that in the first wave, the situation was different. Like even we know that the COVID was there, the pandemic situation was there, but the severity in the first wave, it was not there. But as the days goes on and we experience the second lockdown, the severity was very high. We could see the death, we could see the cry, we could see the problem, we could see the bed unavailability, and we could see the crying from the people. So what happened? One way, the outside environment was so toxic that we were all inside, and as we are all inside, what was happening that the internal environment was also started become toxic. So we were all at home. Pandemic situation was there. We were seeing the news. We were watching everything. And what happened? What was happening is that internal stress was increasing. Internal anxiety was increasing, and many a time we don't know what we are watching, the news, what we are watching, whether it's right or wrong. So what happened as this is increasing, as the pandemic situation was going on, the problematic situation was also going on. So dear friends, you know that during this pandemic situation, many of us, one or the other way, we might have seen suffering, and in our family, relatives, society or community, we might have lost many people because of pandemic or because of this COVID situation. Dear friends, let me share with you. Some of the incidents which has happened or which you might have come across. See, now there might be different issues people might come across, but I would like to share you few issues. Like maybe you might also know that during this pandemic, when person is inside the home, don't know what to do, or much problematic situation, you could see that, or many of us experienced that there were a lot of mental health issues, which I said already. The mental health issues might be stress, anxiety, loneliness, or it can be depression, or it can be conflicts. All these situations were increasing. At the same time, you might have know that some of your family members or some of the community members might contacted the virus and had to navigate to recover. The process takes long time, whether it is a 7 days or whether it is a 14 days. That 14 days becomes more problematic. The 14 days become more stressful because you don't know what is happening. You might have seen the news. 7 days they were, the people, those who got their report as positive, 7 days they were okay. Then 8th day the problem started. So when we see that, or when we, if at all the person is in our home, or if at all if the person is in community, or maybe the person is our loved one, if something happens to them, the problems increases, internal problem increases. Maybe you also know that I already told you, you might have lost the loved one. When I say this, it is very easy for me to say, but the fear, the tension, the cry, the, what I can say, the stress what we pay when we lose when we lost our loved ones, I can't explain through words. But why I'm sharing all these things, because see, one way the COVID and one way all these problems adds. So when all these problems adds, the mental health becomes imbalance. And at the same time, maybe you might have also seen that many of them lost their job. If you see the data, many of them lost their job, and because of the lost their job, there is financial burden was also increasing. The family has to run, you need to feed your kids or children. At the same time, you also should see what is going to happen after the pandemic, whether I'm going to get a job or what type of job I'm going to get. See, these all add stress when you are home during pandemic. All these add stress. At the same time, dear friend, you might also know that many of us might have experienced that. See, children were unable to go to school. The online school was taking place, or home school was taking place. So what's happening is that extra duty on your shoulder, something like you need to teach, you need to take care, you need to do their homework, you need to give extra care. Morning till evening they were in the schools, teacher used to take care, but that work also you are supposed to do. See, dear friends, sometimes it's easy to say, but what happens is that at office the work environment is entirely different. But what happens when you're at home during the pandemic, when everybody is there with the office work? Maybe you might know that everyone know that the work from home concept, but there were a lot of responsibilities were added. Not only the responsibilities were added, with that there were little problem with our mental health, and the stress was also added, anxiety was also added, and more problems were also added. Maybe, dear friends, only few I have highlighted. Maybe there might have 1,000 issues which people are facing. I have highlighted the few issues which are really creating problem. Now, dear friends, we should also know that what is the connection between mental health and substance abuse? The main theme of today's speech is that the link between substance abuse and mental health. Many a time, it becomes a vice versa. As we want to deal with the mental health issue, so what happens one or the other way, we divert ourselves, say that we involve ourselves or we indulge ourselves on these substances and all. And what happened when you addict to any substances? You see, let me make it very clear for you. When you go for the relief of an substance, what happens is that maybe it may give you a temporary relief, but it is not a permanent relief. See, what happens here is that dealing with substance abuse like alcoholism, drug addiction is never easy. And you should also know here is that it's even more difficult when people are also struggling with mental health problem. Dear friends, one thing we also remember that many a time you might have seen that when you have issues, mental health issues, or you might have also heard that when people are suffering from mental health issues, they easily they think of these addictives and all, or substances and all, thinking that these substances will give them relief. But dear friends, let me add or let me tell you that these substances will give you temporary relief. It is not a permanent relief. So what happens? Once the temporary relief is over, then you tend to seek more, you tend to go more for the substances and all. Then what happens is that person may end up with an addiction. Not person may end up with the addiction one way. Second way, what is that? Neither here the mental health problems are not coming down, or neither the substance abuse is not coming down. Both go hand in hand. So what happened? We are going to add more problems. So there are a lot of consequences which the person has to undergo. Let me make it brief, or let me make it very clear for you, like what happens. Now let us know what is this substance. Now, see, when we say repercussions of substance abuse, we should know the substance abuse first. So let me see here, what is substance? Substance abuse can simply be defined as a pattern of use of any substances for mood altering purpose. Dear friends, I'll repeat once again, substances for mood altering purpose. So you're going to alter your mood, but there is no solution. Just temporary relief or the mood alteration will take place. Again, there is also, let me add, substances can include alcohol or other drugs which can be illegal or not, as well as some substances that are not drugs at all. So now what is abuse? Abuse can result because people are using a substance in a way that is not intended or recommended. Dear friends, let me repeat once again what is abuse here. Maybe you might have understood right now what is substance. Abuse is something like it is a result because people are using it or people are using the substances in a way that is not intended or recommended or because they are using more than prescribed. So this is what I meant to say what is substance and what is abuse. So dear friends, let us know now. See, when we say mental health or mental illness one side, when we talk about the substance abuse in one side, what happens with the substance abuse? What will be the short-term effects what you experience? And we will also discuss what will be the long-term effects also. Then I think we can come to a clear idea how the substance abuse will create problem to our mental health, or when our mental health is not good or we feel that our mental health is not balanced, if we indulge or if we feel that substance is what gives us temporary relief, how it will affect our physical health and mental health and how it will affect our personality. Now, to tell you a few things, the short term, there might be many, but let me brief here. The short term effects can be changes in appetite, or you might experience sleeplessness, or the increase of heart rate, or slurred speech. Slurred speech in the sense, dear friends, see what happens once the person is indulged or intake is very high, it is difficult for a person to understand the speech. We may not understand the words, we may not understand what the person is communicate to us. And also the short-term effects can be euphoria. You might have heard the word euphoria. It is called as happiness, but what? Intense feelings, pleasurable feelings, happiness. But again, you should also know that this euphoria or the happiness, what we say, it is a short term, it is not a long term. What we need to really understand is that sometimes we crave for this short term happiness, and once the happiness gets over, we tend to see more. So what happens? You indulge, you in the sense, don't mistake me when I say you, the general sense I'm using here. When one indulge in these substances, what happened? They tend to take more again and again, and here the dosage also increases, and here the mental health issues will also increase. So nowhere there is a conclusion. You will add more problems to mental health, and one will add more problem with the substances. Now, dear friends, we should also know that now I saw you, I told you, or I discussed with you the short-term effects. Now we need to know that what can be the cause and effect, not long-term effect, and drug abuse can if affect aspects of a person's life, that is clear, but beyond their physical health. Now, what is this beyond their physical health is something like as one is indulged into all these substances and all, definitely, dear friends, you might know that relationship problems will occur or relationship problems will develop because you will believe it or not, during this pandemic also, since everybody is together, everybody is at home, the internal environment has become more toxic. Internal, because of the internal environment is more toxic is one way. Similar way, when the person is addicted, the relationship issues come. Maybe the person may not able to maintain and handle his relationship in a proper way. So he or she ends in sufferings. At the same time, the next very important thing is that which we see that poor work or academic performance. Dear friends, what happens is that once a person's become addictive to any substances, it will directly impact on the work. Now, how work will affect it or why it impact on our work life? Because one will lose his concentration, one will lose his focus, internal stress is increased or internal anxiety is increased. At the same time, the focus level comes down. So you will not have any interest towards your academic or work life. So one way the entire academic performance comes down, work life will also comes down or work performance also comes down. Maybe many a time if we don't take proper care of ourselves, then we may end up in nothing. Then the people may throw out from the job. Now, again, I should tell you with all there should be all there can be also difficulty in maintaining personal hygiene. Dear friends, I want to add one experience here. Many of my friends, those who are in this position or they are counselors, they say that the people, those who are addicted or the high level of addiction, They don't even care about their personal hygiene. Sometimes they say that when they go to their room, they can see the worms in their room. Maybe when I say this, it may looks very funny, but what I'm talking to is the reality. They see the worms in the room. The rooms are so messy and untidy, and it is so smelly that a normal person cannot sit in the room, or normal person cannot sleep in the room. Such difficulty it is. So, but what happens is that the person who is addicted, who is staying in the room, he is not bothered at all, because what happens that he is not normal person, that he is a kind of abnormal person there. And dear friends, what happens as the addiction increases? It can be any kind of addiction, as I told you already. So the person's appearance will also change, the body shape will also change, and maybe we can also experience, dear friends, there is a weight loss. And you might have also seen, if I ask you a question here, maybe one way you see the deaths, the COVID deaths are taking place. Maybe we got the news that it is decreasing, a good thing. But at the same time, one thing we also need to understand here is that the risk-taking behavior is also increasing. If you really see, the deaths of youth is very high in India. The data says it very clearly. Maybe I will not say that all the deaths are due to the abuse or addiction and all, but there were certain, or there were reasonable deaths which takes place because of this addiction. Now, dear friends, what happens is that with this substance abuse or with this drug addiction, people love to take the risk-taking behaviors. Maybe don't know where they're going to end their life or what way they're going to end their life. This risk-taking behavior will give them a kick or give them a thrill. But what happens? The kick, the thrill may not end in a proper way. Maybe that may end in a death. Now, then one thing you might, every one of us, we might have observed that loss of interest in formerly enjoyable activities. Dear friend, this is even I feel that a very important thing. Many a time, what happens is that the people, those who are really addicted, the previous activities, it can be sports, games, singing, dancing, art, craft, or any activity where they used to enjoy maximum, they don't feel any enjoyment, they don't feel any satisfaction in the activity, because what happens is that as the addiction level increases, your brain chemicals will also there is an imbalance in your brain chemicals. So what happens is that these are the difficulties, what I said, which affects persons more than person's physical health. So dear friends, what we discussed is the short-term effect. Now what we discuss how it is impacting your physical health. Now let us see, friends, what will be the long-term effects. Now, as I mentioned you just now, the brain structure or the function of the brain is got affected, resulting in the long-term psychological effects or effects. Now, what is this? Now, dear friends, we might have heard depression. It can be one of the main cause. And dear friend, believe it or not, if you take the data, if you take the worldwide data, many deaths are taking place because of depression. Now, many a time what happened, this sadness, this stress, over anxiety, all these add ups. Many a time what happens is that person don't know how to end, person don't know where to stop. So what happened, person don't know with whom they have to discuss. So the problems are, person will add the problems. So the sadness increases, internal stress increases. So dear friend, this can be one of the long-term psychological effect the person can face. At the same time, dear friends, the anxiety. Anxiety, even now, because of this pandemic, people are at home. Being a counselor, I can tell you the anxiety level is increasing. At the same time, panic disorder, increased aggression level will definitely increase. At the same time, with the addiction or with the substance abuse or addiction, paranoid ideas will also increase, like your suspiciousness will increase, mistrusting, or the trust, like you used to trust people, that will also decrease. At the same time, hallucination. Dear friends, let me tell you in a very simple way, hallucination is something like you see the things, you hear the things, or maybe these things happen, reality there is nothing. For example, you see something, in reality it is not there. You, in the sense, the people those who are addicted, or you may feel something which is not there. When these situation increases, it add more burden to your one's life. That is why, dear friends, maybe now when this discussion, you might have come to know that what can be the long-term effects what can be the short-term effects, and if one doesn't have control on the substance abuse or addictives, how that will create more problem to one's personality. So it is alarming call for not only for all of us, but everyone to understand the substance abuse and also understand the consequences of mental health. And also here I also want to request you, and I also want to tell you that if the person is having mental health issues, initially only it is better you consult a counselor, psychologist or psychiatrist. They may be able to guide you in a better way. They may also help you to come out from the problem. Now, dear friends, before discussing with you balancing the mental health, let me also briefly tell you what can be or what are all the treatment procedures one can follow with regard to substance abuse. So here there is something called behavior therapy. Now, behavior therapy, what happens is that modification of behavior. When the modification of behavior, what they do is they will help you to develop a positive self toward yourself. At the same time, they will also teach you cope better with the strategies and also develop problem solving skill. At the same time, there is also something called group therapy. Dear friends, if you have understood Alcoholic Anonymous group, what they do is everybody will come together, and the people those who come out from the alcoholic addiction, they will share how what made me to come out, what I used to do and how I used to. So similarly in the group therapy, all these sessions will take place. So that will help the person. And also, dear friends, also remember, even in the behavior therapy, even in the group therapy, what happens is that from psychologist, counselor or psychiatrist people, you get professional guidance, which is very important. Since they know your problem very well, they guide you in a better way. At the same time, dear friends, what happened? Maybe, once the person want to come out, quit from these addictives and all, withdrawal symptoms, the person may also face withdrawal symptoms. That time, I think we need medication. And also with the medication, you need proper medical care, you need proper guidance and counseling from the professional people, which will help you to deal with your own problem in a better way or deal one's problem in the better way, and which will also help him to come out. So dear friends, if this is something what I wanted to share you is that how mental health issues will cause substance abuse, or how mental health and substance abuse sometimes go together. That is why, friends, we all need to understand is that any small issues, a mild level of anxiety, mild level of stress, or if you feel sad, if work pressure is increasing, or internally you feel isolate yourself or lonely, it is better to discuss on the right time. See, if we go to all these temporary relief, remember friends, again the word in inverted comma, it is only temporary relief. You will not get any permanent conclusion for your problem. That is why it is better on this treatment. Why I'm highlighting this, because you need to really what you need to really do is that you need to really know to whom to talk, whom to guide, from where you should seek help. So that will help you to come out. So dear friends, with this, let us next discuss a very important concept of today's topic, how to balance mental health. So dear friends, what I was discussing with you is that the consequences or the correlation or the connection between mental health and substance abuse. And I also told you how and what we need to do to come out from this substance abuse or addiction, and what will be the consequences of long-term effect and short-term effect, and at the same time how that will create more problem to our personality. Now, dear friends, let us discuss how we need to balance during this pandemic, or what are the methodologies or what are the activities we should do to balance our mental health during this pandemic. Dear friend, first will be take a break. Here, take a break is not from the work. There are other things I will discuss, but take a break in the sense, see, usually what happened is that during this pandemic, whatever you do, you should get that inner motivation and you should get the happiness what you do. So here, take a break in the sense, what I really mean to say is that nowadays what happened, we watch media, we watch news, the consumption of news is very high, or watching media, TV or the series is very high. Dear friend, sometimes what happens is that anything becomes too much will create problem. So now the thing what we need to understand is that how much is too much, only you can judge. Now, if at all, whatever news you watch, if it is going beyond the problem, whatever news you watch, if it is creating more issues in you, then you should really come out from that. And dear friends, sometimes what happened, I even some of my friends also told me that watching series, continuously watching series and analyzing that I am that person, and that influence the mental health in a negative way. So that is why what you watch, what you analyze is everything is equally important, because that will create negative impact. That is why, dear friends, take a break. In the sense, imagine if you watch more news, if that news is creating problem in you, if that news is spoiling your mental health, dear friends, there you need to take a break. And if you feel that you are continuously, you are in social media or continuously you are using the electronic gadgets, and if that is spoiling your mental health or that is creating an inner pressure, then definitely you need to take a break. You need to take a break so that you will not add further problems to your mental health. So next is verify all the information you get. Dear friends, again, this is very important, because nowadays what happen is that we see a lot, or what I can say, we everywhere in the print or any media, or in the TV media, social media, any media, there are a lot of information is circulating. Now it is very important for every one of us what I need to believe, what I should not believe, or how good I am in verifying the information what I receive. Now, for example, many a time what happens is that, especially when it comes to home remedies, when it comes to medications, when it comes to symptoms of the disease, or when it comes to different web links, they will tell you, click this link, click that link. Or many times you will be given the phone number. If at all you're feeling lonely, feeling sad, you dial this number. There are people to handle you. There are people to talk to you, interact with you and all. Dear friends, you need to verify all this information, because if you really see the consequences, many a time, if you see the news in a proper way, the person will also end his life. Don't know what way the person is going to end his life. The best example here, which I can give you, I think years ago, 1 year or 1.5 years ago, you might have seen that how our own childrens were addicted to blue whale game, and what happened next, and how, and we have lost many of our children because of this addiction, gaming addiction. But what I need to really say is that you need to really verify before click, before going to any site, before practicing any home remedies, before practicing any medication. Because many a time what we do is that we say in the WhatsApp, we go to medical shop, we purchase the tablet, we take it, but we don't know the consequence of the medication which will happen in our body. That is why you watch news, but before trusting the news, try to find out whether it is fake news or whether it is a real news. If at all fake news, you have to be very careful, because many a time, dear friends, you will believe it or not, practicing this medication, practicing these home remedies, even we see the deaths among our people, because nowadays we are so confused, we are so fearful, we are so stressed that we tend to believe in the information so easily. That is why, dear friends, it is very important, whatever the information you get, there are a lot of methods you can really verify the information. You have to really verify the information what you get. And see, dear friend, this one, you definitely connect with friends and family. Many a time what happens is that people also say, I don't have anybody, I don't have friends, I don't have the family members with whom I can speak. Dear friends, there are few apps, if you really go through few apps, which will give you people, which will give you personalities, or which will give you professional people where you can talk to them, where you can interact with them. There are professional team members online, they are ready to take your call. So it is always important in a day you spend a time with your friends, with your family, through online media or through whatever media you want to connect. Maybe that will also help you to lower your burden. Sometimes what happens, we store everything, the problems we store, the emotions we store, the stress we store, the anxiety we store, all these things we store. It is always better, dear friends, if you speak or if you interact with the people. I think then the situation may also become good, or you also get a relief. And what happened when you really share your problem, once you start sharing, sometime automatically you may find some conclusion or some solutions for your problem. Next, take a time to unwind. Unwind here in the sense something you need to really relax yourself. Now, what is the relaxation here is simply sitting is not a relaxation. Maybe sometime meditation can be a relaxation. Or what I really want to tell you here is that, see, now during this pandemic, I will also agree, even you will also agree with me that we are in between the four walls. We can't go out because the situation is very worse. Maybe sometime even if we go out also sometime, and nowadays we see the news that the lockdown has been lifted and all, but dear friends, still there is a risk. So relaxing is something, but do the activity which you love to do. Do the activity which gives you a satisfaction, or do the activity which create inner motivation in you. And dear friends, remember, when you do this activity, definitely it will give a positive impact to your mental health. And this will also help you to come out from stress and anxiety or tension, whatever you're facing. See, relaxation is not, I'm not mean to say only simply sitting is a relaxation. Relaxation is also something, the activity which you love to do, the activity where you get enjoyment, or the activity which gives you satisfaction. If you do these activities during this time, apart from your work, this will also help you, or this will add to your mental health. That is why, dear friends, always remember, select an activity which gives you joy, happiness, and inner peace. Now, see again, here I'm again repeating the things. Connect with the professional. Who are professionals here? They can be psychiatrists, they can be counselor, trained counselor or counselor, they can be psychologists. Because see, dear friends, what happened? I want to give you an example here. Many a time, what happens is that we share our problems with the friends. See, dear friends, it is not wrong. Sharing our problems with the friends is not wrong. But always remember one thing, your friend will give you only the suggestion which he or she may know or might know. They may not go beyond that. Now, professional people, what they do is they know these psychological issues, psychiatric issues very well. You know, dear friends, if you go to DSM criteria, if you go to ICD criteria, there are list of disorder the individual might face. So all these disorders are properly studied by this professional. So whenever you go with the problem, when you really connect with the professional, they know what you're undergoing. They know what you are facing. That is why many a time what happen, your friends might give you suggestions. Sometime it may work, sometime it may not work. And when you go next time with the problem, they may not know what to do. That is why right time, taking right help from the right person to the right situation is what is very important. That is why, dear friends, let me stress here, connecting with professional is equally very important, because believe me it or not, that will help you to come out from problem very easily. Now, what happens here? When you connect with your professional, they analyze, they assess, they evaluate, they guide you, they advise you, they may know the in-depth of your problem, and they can give you proper solution, or they can refer you with whom you have to go and meet. So that is why it is the important thing is that, believe it or not, the professional people will guide you and really will give you better advice, because they are the best person to understand your problem when it especially comes to mental health. Now, I have already discussed with you, keep yourself active. Whatever you really like to do. For example, many people say that let me not give you a general things here, do this, do that and all. No, whatever activity which makes you happy, like for example, for some it is reading, for some it is watching TV or entertainment, for something spirituality, or for some it is listening music, or whatever the activities which gives you, which makes you really feel happy. Please do this. There's a one thing. Now, what I really mean to say here is that you need to really keep yourself active. Keeping yourself active in the sense, you need to keep yourself busy in one or the other way. So nowhere you're sitting alone, because what happens when you sit alone, there might be a chance where loneliness will increase, or there might be a chance where isolation will increase. There might be a chance where lot of negative thoughts will come to your mind. When negative thoughts come to your mind, automatically it will affect your mental health. That is why it is very important for you people that keep yourself active. Whatever way you want to keep yourself active, it is left to you. Whatever the activity which gives you joy and happiness, you need to really do that, because when you really keep yourself active, what happens is that you're not allowing the negative thoughts to enter your mind, or you are not giving any scope to enter. Scope in the sense you're not giving anything to enter in your mind. So what happened? You're occupied, you are busy, you are involved in one or the other activity. So what happens is that it is very important when it comes to balancing mental health, you need to keep yourself active. Inner activeness and outer activeness, both are equally important. And here, dear friends, here, perform regular check-ins with yourself. See, now the quotation goes like this here. You can also read this. Today, do one little thing to take better care of yourself. Now, dear friends, you need to understand that you, in the sense, in general sense, I'm saying one has to really understand that what is bothering you, or what are all the aspects which is creating problem to you, or if it is person, who are all the person who is creating problem to you, and what way you feel that your life is not balanced, or what way you feel that your life is not going in a proper direction. See, dear friends, many a time what happens is that we listen to people, the negative remarks, we listen to people in the wrong way, we analyze ourselves in the wrong way, we end up in doing nothing. It means that it adds more problem to us rather than the solution. That is why, dear friends, regular check-ins is nothing but, are you really feeling sad? Are you really anxious? Do you feel that you are overly pressured? Do you really feel that all these problems are creating more problem to you? All these check-ins will help you which area you are going wrong, or which area you need an improvement. At the same time, that will help you to take care of yourself better. Let me go to the previous slide once again here, because whenever you feel that you feel low, you feel tensed, you feel anxious, you feel stressed, you feel lack of motivation, you feel you are in problem, you feel that your family life is toxic, you feel that you are in conflicts, or you feel that your mind is not working in a proper way, you feel that your brain is not functioning in a proper way, you lack inner motivation, you lack inner peace, all these check-ins will help you to reach the right person. Let me go to the previous slide once again here. This is the time for you not to discuss with the friend, but discuss with the professional. They can give you better advice and guidance. And here, friends, again, find a distraction. Find a distraction is nothing but, you should also know that, see, many a time psychologists, what they say is that some chronically difficult condition is helpful to divide the problem into two categories. Things they can do something about, or then things they can do nothing about. Dear friends, if there are things, if you could do something, then you don't have to worry. Now, when you know that there are certain problems which are really creating, which are really affecting, and you feel that you cannot do anything, you need to really stop it. Because many a time what we do is, it's a human nature. I don't blame anybody for that. We are stuck in a problem and we add more to it. Instead of finding a proper solution for that, we add more to it. And sometimes in a point of view, in a central point of view, we realize that I am not able to solve this problem, and no, it is not the question of that you are not able to solve. Sometimes we feel that we are unable to solve, but we don't find a solution. We add more points to it. So that what happened, it will also spoil our mental health. That is why distraction here, in the sense when you feel overly stressed, it is better you do something which gives you more satisfaction. Then what happened, there are a lot of ideas will come up. Again, dear friends, again, let me also highlight here. If you feel that you're so much distracted, one way. Second way, if you feel that there are certain things where you're not able to find a proper solution for your problem, it is the right time for an individual to consult a professional. So here, Quinn suggests using a simple tracking system where you rank each day on a scale of 1 through 10. Dear friends, what I really mean to say here is that now if you take this 1 to 10 criteria, 1 is being lowest, 10 is being highest. But how it should go is that, now, for example, today if you are very happy, then you don't have to worry. But what happens is that as the days goes on, if you feel that you're feeling low, sadness is increasing, and all the psychological problems are increasing, it is again a call for you to speak to a professional. Dear friends, this is a very simple activity which I would like to suggest you. If you feel, if those who are listening, even if you feel that somewhere some distractions are taking place, somewhere some problems are taking place, or somewhere you feel that life is not going in a proper direction, or you feel that life is in a not proper way, then I think this activity will definitely help you to rank yourself or to mark yourself. Dear friends, that every day if you feel that you are in the note of 10 or if a range of 10, you don't have to worry. But as the days, day by day, if the number is decreasing, today is 10, 9, 8, then it is a call where there is some disturbances going on in your mind. And that is a time where you need to really consult a professional. And your friend, all these suggestions, why I would like to tell you that one or the other way, this will definitely help you to balance your mental health in a positive way. And right time, taking right help will definitely help you to come out from the problem. Dear friends, I hope and I believe many a time we need to really work together to balance our mental health. I take this opportunity to thank the Director, Department of Student Affairs, Dr. Geeta Maya, for giving me this platform to share my views or discuss my views with you. I also thank our beloved Deputy Directors, Dr. Veena Meben, Dr. Ashwini, Professor Roshan David. I thank them for their cooperation and support. I thank my colleague, office staff, everybody for this opportunity. And thank everyone for listening so patiently and allowing me to share my views. Thank you.
Thank you, sir. Thank you, sir, for enlightening us on balancing mental health during COVID pandemic and repercussions of substance abuse, and sharing your experience and views with all of us. I now request Dr. Veena Meben, Deputy Director, Student Affairs MAHE, and Professor in the Department of Humanities and Management at MIT Manipal, to propose the oath of thanks.
Good evening, everyone. On behalf of the Department of Student Affairs MAHE, I would like to express my heartfelt gratitude to our eminent speaker, Dr. Rayan Mathias, for accepting our invitation and for inspiring us with his informative and enlightening talk. I'm sure each one of us has gained a better understanding of effective ways to deal with stress during these difficult times, and also of the alarming repercussions of substance abuse. With a deep sense of appreciation, I thank the MAHE officials, heads of various institutions, faculty members and student friends for their constant support and motivation. My special thanks to all the participants from various institutions for showing their interest and attending today's talk. My heartfelt thanks to Dr. Geeta Maya, Director Student Affairs MAHE, for welcoming the audience and for introducing the speaker, and also for her rock-solid support and encouragement throughout. I would like to thank the Master of Ceremonies, Mr. Calvin D'Souza, Student Counsellor MAHE, for taking us through today's program. On this occasion, I also express my gratitude to the Ministry of Social Justice and Empowerment for entrusting us with the project Nasha Mukt Udupi Abhiyan 2021. The audiovisual team of MAHE, headed by Mr. Suresh K, have rendered their valuable support for all our activities, and we are very grateful to them. Special thanks to the Deputy Directors, Dr. Ashwini Kumar and Mr. Roshan David, Dr. Binil, Associate Professor MCon, Ms. Nikita Menezes, Legal Executive MAHE, and Office Associates of the Department of Student Affairs for their wholehearted support and encouragement. Finally, a big thank you to each one of you. Wish you a pleasant evening.
Thank you, madam. Once again, I thank all the participants. If you have any queries, kindly mail them to dsa.mahe@manipal.edu and they will be forwarded to the speaker. Thank you and wish you a good evening.